I am Dr. Louis. My friends call me Mark. This video is for you if you have a family history of colon cancer. The title of this video is High-Risk Colon Examination Targeting High-Risk Polyps in the Right Colon. Now I have a word about colonoscopy. At the advent of colonoscopy was thought to be infallible. Even now, a lot of people still believe colonoscopy is infallible. For diagnosing inflammatory bowel disease, colonoscopy is the examination of choice. However, for detecting polyps, multi-center studies reported high miss rates. In the Annals of Internal Medicine, high miss rate of precancerous polyp was especially bad in the right colon. Every colonoscopy says colonoscopy is not 100%. The purpose of this video is to fill in the shortfall of colonoscopy with existing technology at a low cost. It will also help you to guide your loved ones to avoid colon cancer. There is nothing to buy and nothing to subscribe. The natural history. Colon cancer develops from polyps called adenoma. It takes 5 years for an adenoma to form and another 5 years to change into an invasive cancer. Size is the major factor. Cancer in polyps under 1 centimeter in diameter is very rare. Definition: high-risk polyps. They are precancerous polyps, adenoma, of 1 centimeter or larger. They are silent. If left alone, they will become lethal. Definition 2. Right colon. The right colon is the proximal 4 segments of the colon. The left colon is the distal 4. The definition of the right colon is very important to the colonoscopies because that is the most difficult part for colonoscopies. Existing technology. Technique number 1. Fluoroscopic barium enema. All 29 polyps of 1 centimeter or larger were seen on barium enema as reported by TV and Carlson of the Mayo Clinic. Hence, this technique, aka Mayo Clinic technique. There were 1,500 patients. This was no ordinary barium enema. A very special maneuver called vigorous palpation was used to get this. Technique number 2, modified Mayo Clinic technique. All 7 polyps of equal to or greater than 1 centimeter were detected, as reported by me. There were 142 consecutive patients in this study. It was no ordinary barium enema either. Deep external compression was applied inch by inch to the length of the colon with a special device called pneumatic radiology compression pedal. At the end of the examination, I also did a double contrast examination of the rectum. Now I'd like to show you an X-ray picture from one of my studies. This white stuff is barium inside the colon. This is the cecum. This round thing is a metal ring inside the compression pedal. I have attached a metal bar of 1 centimeter in length to the pedal. In this picture, you see a bubble-like defect. Using the metal bar, you can estimate the diameter of this defect, it is 1 centimeter. It is a 1 centimeter polyp. There is a smaller polyp of about 0.5 centimeter in the same picture. The third technique is called colotomy, colonoscopy of Dedish and Hertz, or CCDH. I repeat, CCDH. It is the most accurate polyp detection and management technique ever developed. My hypothesis is something like this. If any and all polyps of 1 centimeter or larger were removed, that will eliminate all high-risk polyps. Unfortunately, there are blind spots in the medical community. No GP or family physician have heard of fluoroscopic barium enema that I know of. Very few specialists heard of the modified Mayo Clinic technique. Less than 1% of the members of the American Medical Association read the article in Annals of Internal Medicine. Looking at data from Germany, US, Canada, Dr. Baxter and co-workers reported this, I quote, "The relative risk for left-sided tumors after negative colonoscopy was less than 0.2, whereas proximal cancer risk ranged from 0.40 to 0.67, unquote. In other words, the miss rate of high-risk polyp by colonoscopy in the right colon is a whopping 40 to 67%. I repeat, 40 to 67%. How to get one of those exams that can detect all of the high-risk polyps? Your action is essential. Please Google TV and Carlson, click PDF and full text, print the article, and highlight the above-mentioned quotation under results. Do the same thing for Baxter Annals 150. Print the article, highlight the quotation under discussion. Bring the printouts to an acute care hospital. Please avoid very large hospitals because they may not have done barium enema for several years. At the hospital, be very proactive. Specify fluoroscopic barium enema or modified Mayo Clinic technique. Show them the printout. Otherwise, they won't know what you're talking about. Be sure what you get is not the ordinary barium enema, not the single, not the double. The cost of either of this one is usually less than $100. For example, in BC, it is $96.63 Canadian money. The advantages of the hybrid colon examination: number 1, facilitate the selections of patients with polyps of 1 centimeter or larger for prompt colonoscopy, and for CCDH if such polyps were not reached or was missed by colonoscopy. 2, shorten the backlog of colonoscopy due to COVID-19. 3, increase the probability of preventing colon cancer. Little reminder, please do not skip the annual home stool test. Thank you for watching. Please Google the above 2 articles. By the way, please observe a moment of silence in honor of Chadwick Boseman. Thank you.